ले check ले check ठीक है ले ले हेलो लो चेक चेक वन वन टू टेस्ट ठीक है लो चेक 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 वन टू टेस्ट लो चेक 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 वन टू टेस्ट लो चेक चेक वन टू टेस्ट हेलो लो चेक वन ठीक है हाँ वहाँ बढ़ा दे लो चेक वन और बढ़ा दे हेलो लो चेक वन लो चेक 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 वन टू हेलो लो चेक लो check one लो check check
Good morning, everyone. So the event is about to start.
हेलो हाँ. Ladies and gentlemen, respected guests and esteemed experts, a very good morning to each one of you. Today we have gathered here for an exceptional event that signifies the convergence of cutting-edge technology and healthcare innovation. I am Dr. Atreyi Ghosh, Scientific Officer at IIT Indore Drishti CPS Foundation, and I have the honor of welcoming all of you to SETU 2024, a unique stakeholders engagement event jointly organized by All India Institute of Medical Sciences, New Delhi, and IIT Indore Drishti CPS Foundation, which is a technology innovation hub under the National Mission on Interdisciplinary Cyber Physical Systems, NMI CPS. We strive to promote translational technology development, commercialization, skilling, and startup support. In the ever-evolving healthcare landscape, collaboration between medical institutions, practitioners, and technology-driven entities becomes paramount. SETU 2024 aims to facilitate this collaboration by bringing together experts and stakeholders across various disciplines. Our primary objective include assessing opportunities for technological enhancement, identifying healthcare challenges, proposing innovative solutions, fostering impactful networking, understanding technology integration in healthcare, and formulating strategies to navigate challenges, ultimately aiming for accelerated commercialization and enhanced patient outcomes. It is with great honor that we extend our invitation to each of you esteemed experts to participate in this event. Your insights and expertise will play a pivotal role in shaping discussions and formulating actionable strategies for the technological upgradation of the healthcare sector. So to begin with, we have a couple of our startups and technology development research scholars and faculty members who will be presenting their work. It is a quick pitching session that we have arranged. So 40 seconds we give to each of these presenters to explain their technology or the solution they have come up with, and then the audience would be given another minute to ask them questions or any queries they have. So with your permission, we begin with the session. I would like to request Dr. Shovan Verma from Medication Management System. He's a faculty at IIT Guwahati. Sir, we request you to be here on stage, and we start with the presentation.
There should be the slides. Oh, good morning, everyone. I am Dr. Shobhan Verma, Associate Professor from Indian Institute of Information Technology, Guwahati. Here I want to present my solution. The name of the system is medication management system. In the existing healthcare system, what we don't have means the doctor, whenever they prescribe some sort of medicine, and the patients who are consuming the medicine, we don't have any system to track how they are consuming this medicine and in their body what kinds of situations are going on. So here we propose one system, one pill or medicine dispense box. What it will happen, we can store the certain sort of medicine there. The user, they have to put some, okay, they put the finger and the pill will, it will dispense. So that time, all the records, every time, whenever the patient is consuming the medicine, minimum health records, it will be captured, and that will be shared with the doctor. And this time what will happen, what kinds of medicine he is consuming or he or she is consuming, and what time non-compliance, these kinds of records we can track. And this sector actually is overlooked, because ultimate thing is whenever the good doctor, what they need is, if the patient is not consuming the medicine, then there is no meaning of any sort of treatment. And doctors, they need the feedback whenever they prescribe some sort of medicine and what is going on during that time. So this is the solution, and the application area, this system they can take like government agencies, pharmacy, pharma companies, or personal doctors. This is the main solution, and presently I set up the startup in IIT Guwahati, and by this end of this year, the beta version I want to launch. So this is my innovation.
So this is very good. You have come up with this. So this medical management system is used by patient or hospital or the doctor. Who is monitoring it?
By the patient or caregivers.
So is this, you have an application, you are making an application?
Yes, yes, yes.
So the patient should have the smartphone?
Yes, yes.
And patient will be prompted?
Yes.
At the time of medication when is to be taken?
Yes.
That's what you are
Yes,
doing?
yes. And that time, the say, if you put the finger, the heart rate, it will be captured, and it will be recorded, and it will be shared with the doctor also.
So basically, those who do not have a smartphone cannot use this.
Actually not. We can put a GPS system. Directly we can connect with the local servers also.
No, but it has to be the smart, what you call a smartphone.
Yes.
So somebody who doesn't have a smartphone, we cannot.
For the time being, we haven't
So
implemented
it
that.
will leave out a significant section of society.
Yes,
So
we
I
can.
think you have to work on that how, because this is a problem as much with me, the compliance of medication, as much with anybody else.
Yes.
I think that is what.
Yes,
you
actually,
have to
sir,
say.
we are working on
So,
that part.
Yeah, thank you.
Okay.
Thank you, sir. Next, I invite Dr. Tanveer from Bennett University to give a presentation on the technology he has developed.
So, okay, hello everyone. So we are not typically from healthcare, we are from law. So I'm going to put one word out there. ChatGPT for law. I think that's self-explanatory what we are trying to do here. We are trying to create a digital twin of an experienced lawyer. We are trying to compete, we are trying to build something that has been done only in the US and UK, and we are trying to democratize Indian law. Semantic searching, judgment prediction, fact-based analysis, argument improvement, automated legal research, and so many other things. If you want to see what we have built to some extent, please visit our stall called Digital Assistant Attorney. And just to give you an idea, so I was told like 5 minutes back it's a startup pitch. So $650 million is the US equivalent of the company that was sold to Thomson Reuters. That's what we are trying to do. If you want more details, and I have only 40 seconds, I cannot say anything else, please visit that booth. Thank you. Yeah, so we have built one prototype, one specific prototype for healthcare where we have built a cross document. You have huge corpus, considering insurance companies, sir. Imagine you have huge corpus, a cross document legal question answering system. Traditionally, GPT type system, you have what, let's say, I mean, people build, students build, and companies, they build question answering from a single PDF or a single doc file. We have built it from multiple, maybe thousands of doc files. A small demo of that at the intersection of healthcare, insurance specifically, and the legal aspects. Insurance में legal, there are so many issues जो patients face करते हैं. I faced myself, so वहीं से, and he has also faced the same thing. So वहीं से वो गुस्सा transformed into that automated legal question answering system for healthcare. So we built that. It's a small demo. We've been given $100 to experiment for a month. So 10,000 रुपए में कुछ होता नहीं है, but see what 10,000 रुपए per month can build. Stall number 14.
So, very good. How many languages you are working on?
So only English.
Why not in other Indian languages?
So first of all, the models that we are using, there is,
Because now many judgments, Supreme Court also has put up in other languages.
as of now, we have experimented on English, but modern technology, of course,
When
regarding.
you said Chat GPT, so take advantage of Chat GPT.
So absolutely, we can modify it to Hindi.
So
We
that
can
if I
modify-
want to read Tamil, I can read,
Sure, sir.
and you want to read Hindi, you can read.
So 2 लाइन ऐड करनी है, पूरा हिंदी के लिए हो जाएगा.
हाँ तो ये करना है ये.
So
This has to be
we,
done. The other thing, may I request and also suggestion that if you can dig out certain litigation in healthcare and make medical fraternity aware of how they can benefit from that experience, avoiding litigations, how patient safety, hospital safety is important.
sure.
So I think that is one dimension which you can little bit go into healthcare.
So we did it for motor vehicles, we can do it for healthcare.
Yeah.
Transplantation of organs right now he has built, so you can see that as well.
And have you approached any High Court or Supreme Court with this?
So High Court lawyers, judges.
Judges, yeah, that's
Judges.
what I'm saying. Chief Justices.
So not chief justices, जो हमारे यूनिवर्सिटी में आके टॉक देते हैं वो judges.
Decision तो वही करेंगे courts में. Like they are for it. They are now for translating these judgments into Indian languages, Supreme Court judgments, High Court judgments, because if vast majority of a nation remains aloof from the judgments, even we cannot figure out those who know a little bit of English.
Sure,
So what to talk of the common person who doesn't understand English at all?
absolutely.
Thank you.
Thank you, sir. Sorry, sorry.
If I may add to Dr. Mishra, I'm a trauma surgeon.
Yes,
So
sir.
one of the most important aspects that comes during resuscitation of a trauma patient is the Good Samaritan laws. That means as a physician, you are trying to save a patient, so there should be no legal responsibility.
Sure.
People in this country think twice before they come up with resuscitation strategies, wondering the legal implications. So something that you should think about addressing.
Yes, sir.
It is already addressed by the Supreme Court. Supreme Court has already given this judgment guidelines, Good Samaritan law. Only thing people need to be aware, and hospital emergency departments need to be aware that anybody who is bringing the patient, if he or she doesn't want to be bothered, it is okay, even if they have committed an accident, and leave the patient and go. This is already, this niyam is already existing, and it is by the Supreme Court.
Okay, thank you.
Thank you, Dr. Tanveer. Moving on, next we have the team from Unino Healthcare.
Hello everyone. Have you ever encountered a perplexing situation where a medical treatment has led to unexpected health complications? Yes. So we at Unino are aiming to revolutionize every medical intervention. One of our patented technology, Plurago, is improvising and bringing efficiency in one of the most common life-saving procedure, chest drains, which are used in both the cases, traumatic and non-traumatic situations. this technology shortens hospital stays, increases patient turnover for the hospitals, and also brings success rate of surgeries performed by the hospitals. Join us to be a healthcare game changer with. And we're looking forward for collaboration in for our patient trials and any other collaborations to develop more technologies like this. Thank you.
So besides chest drain, anything else you have taken up?
Yes, so we
Gradually you have a vision to take up other procedures also?
Yes, definitely.
Are you working with some healthcare facility?
Not as yet, but we've got our prototype reviewed by 6 different hospitals pan-India.
So they are on board?
Not on board, but as an advisors. I mean,
But they have to be on board. Unless hospitals are on board,
so we are just starting with it. So that is the reason we are looking for collaborations if we can get any support for this.
okay, so you can talk to a lot of people here and see
Yes,
where
definitely.
collaboration
That's
can
why
take
I'm
place.
here.
All the best.
Thank you, sir.
Next, I would like to invite the team from GoodMed.
Hey, good morning, everybody. We are GoodMed. So we discovered a problem during COVID, like people were, facing issues, and for them it was so difficult to read prescriptions. So now, with the help of GoodMed technology, you can simply get, any patient can read their prescription, their handwritten prescription by the doctor very easily in few seconds. So when you talk about digitization of the prescription, it is so easy nowadays where you can simply upload a prescription on a platform and get it digitized in few seconds. This is what I said. So when you talk about the prescription, not only in English, we are giving this digitization into Hindi language as well, and very soon we are coming up with more languages. And where the people were struggling with their medicines, they were unable to take their medicines on time. Along with the digitization of the prescription, we are also giving medicine reminders so that they never miss their dose, especially for their medicines itself, right? So with and the best part of this technology is, like, we are not asking doctors to change their practice of way of practice they're doing it. Like, we are not asking doctors to have any digital pad or any scanner or something like that. The way that they were writing it on the paper, they can simply write it, scan with our smart camera. We have a smart camera, they can scan it, and that gets uploaded and digitized in few seconds, and they can, patient can use it in their language as well. And just a quick second, by help of this GoodMed technology, people can discharge within 10 minutes. So this is what we have right now. Thank you so much. Thank you, everybody. Thanks.
That's wonderful, but you also have an application?
We drive through WhatsApp, so
How are you going to read the prescription, handwritten prescription?
So that technology we have developed so far works on the image processing itself. Any image of a prescription having 4 corners with a certain clarity we need, so that our technology...
No, certain clarity. You yourself have answered my question. So sometimes we cannot read our colleague's prescription.
The clarity of the image is only required. No, I'll be very honest with you. Only the clarity of image should be there, which should be sharper in nature. The contrast of the image and color should be sharper.
But you haven't tried it on ground.
We have tried everywhere.
No, you have tried prescriptions, handwritten prescriptions.
Yes, we have tried more than 10 lakh prescriptions, sir, and that too we have worked with hospitals.
So what was the error there?
So the error rates that as on today, 97% of accuracy we are able to provide with a certain level, with prescriptions that come to us as an image. We have a storehouse of one of the biggest databases of handwritten prescriptions which we have created in last 2 years. With all the medicines of India in English and Hindi, we have converted to IC10 codes, and SNOMED CT has been utilized to categorize the symptoms across
That's
it.
okay, that's the diagnosis part.
Right.
What I am asking, suppose I write something,
Yes.
how accurately this will,
I will give you an answer, sir. The proof of the pudding is in the taste. You can try it right now, and you can definitely
We'll try,
see
we'll
it.
surely try, because sometimes it's very difficult to read.
Absolutely. It is, and these days we are serving like more than 98% of accuracy on our prescriptions. And last month we delivered 99.7% to Apollo hospitals as an accuracy, sir.
I think that you have to see
Yeah.
and do, you are saying 10 lakhs prescriptions, so I have to believe that. But writings is a huge issue.
Right, sir.
And if in case your, this read something else downhill to Dependol, I don't know.
So that depends, you see, I tell you one thing, there's a process, like, we are not sending any prescription without, a validation of it. So we have doctors aligned before it gets, get it to the patient. We have doctors aligned, those who are validating the prescription, whatever it is digitized, and then only a doctor has this button to push, to
that's
send.
okay, that's
Yeah,
okay,
yeah.
that's
That's why we are committing more than 97% of accuracy and we are giving it.
Then only it will be.
Yes, that's right. That's
So,
right.
technology is first trained, and then it will get performed in units.
Thank
Thank
you.
you.
Thank you so much, thank you everybody, thanks.
Next, we have a team from IIT Bhilai.
Hello. Hello. Hello, hello. I'm audible? Right. So, good morning to one all present here. Today, I, along with my team, represent my device known as Tris-Ease. So, let's talk about the disease known as trismus. Trismus is simply a disease, a condition called as a lockjaw. It inhibits the range of motion of the lower jaw and inhibiting the basic necessities of the patient like speaking, swallowing and eating. It's a very severe condition and has a severe emotional impact on the patient as well. Here we present our model. Hello. Here we present our model, which is the smart device known as Tris-Ease. So this is the mechanical model, and so in what happens, there are two jaws which goes into the mouth of the patient, and based on the mechanical lever principle, the patient can simply apply force and open its mouth. However, this has its certain limitations. Basically, it doesn't have any sensors or any IoT technology to monitor and store the data of progress of how the patient is being improved. So here we present a sensor modeled IoT enabled device. It has sensors integrated into it which can monitor the amount of distance the patient's jaw has been opened, moreover the amount of force the patient has applied to open its lower jaw, as well as the number of cycles the patient has done the exercise. This can help the doctor to monitor the various parameters and see on a mobile application for monitoring the patient's progress. Thank you.
And you have seen on the patients.
No, actually it's on a prototype stage. We have not yet used it on patients.
So any patient with trismus, or you will differentiate?
See, basically it's a condition which inhibits the lower jaw
So
movement.
that's okay.
Yeah.
There could be a cancer inhibiting
Yeah,
it.
a cancer in mouth cancer.
There could be ankylosis of the TM joint which could be doing this.
Right.
So will it differentiate that or not?
Absolutely no, absolutely. This is the main advantage of this device. This is robust in its sense. Any mouth-related sickness inhibiting the motion of the lower jaw, this device can be used. It monitors all those sensor parameters and stores them on a database which can be seen on a mobile application.
No, is it for diagnosis or you are offering as a therapy?
No, this is as a therapy, as a physiotherapy exercise basically, because this trismus disease, major medication of this disease is using physiotherapy exercise.
Yeah, that's okay.
Right.
That is in benign conditions where it is possible. But in cancer you need treatment.
In cancer we need treatment, but it can be used for physiotherapy. I'm only targeting the
You are trying
physiotherapy
to-
area.
Physiotherapy, so
Right.
cancer has to be ruled out.
Cancer has to be ruled out. It's only on the area of physiotherapy. So the patients can themselves monitor and see their progress also. It stores all the data.
Can it predict that which trismus can be treated with this and which cannot be?
Till now, we have not enabled that thing, but yes, in future, we can also deploy a machine learning model which can predict.
Because if it predicts, then you can select patients who would go for surgery.
Right,
For
right.
Christmas.
Right.
Thank you.
Thank you.
Next, we have a team from EasyOFI.
Hello everyone, a very good morning. So we at EasyFi Solutions, we have created a cloud-based AI and XR-enabled platform for storing medical images, and also we do the analytics on those medical images for brain tumor. Along with that, we have also automated complete automated brain cranial implant process. So impact of that, I'll just share that initially when this problem came to us, it was for brain cranial implant, it took around 2 to 3 days. Using our automated process, the 3D print is created within hours. So basically we have created complete platform for sharing medical images, for second opinion, for teleradiology, and based on that we also support, our AI also support for diagnosing diseases like brain tumor and all, and also it helps in segmentation of brain tumor, COVID lungs. So yeah, this is the product that we have.
Both brain and lungs.
Yeah.
You're
So
saying
for brain tumor segmentation and lung tumor segmentation, currently we have that.
and you do 3D printing as well.
So we have automated that brain cranial implant surgery process for 3D printing to create that 3D print.
So have you worked with some neurosurgeons?
Yeah. Currently we are working with neurosurgeons. So we are working with PGI Chandigarh. They bring us the real data, and our system is being tested with them.
What about lungs?
So for lungs, yes, with Vidisha District Hospital, they are using that solution, current solution.
So you said
So it's
post-COVID.
for only COVID.
Only COVID.
Only
Why
COVID.
not other problems also?
Yeah, that we can certainly work out. So basically, we need data to train the AI
like
for
you
that.
have done for brain.
Yeah.
You are doing it for brain. The same thing, because lung cancer is going to be one of the leading cancers.
Yeah. That we can. So we just need the AI to train that. That can be done. That is not an issue. Yeah. Sorry. For TB? No, not for TB right now. It's for just for tumor, COVID lung, basically.
Okay. I'm just throwing you an idea because in hinterlands of in the country, there is diagnostic difficulty in pulmonary tuberculosis. For primary care physicians.
Broadening its scope.
Yes. So
COVID is over.
right. So we.
Tuberculosis remains.
Yeah.
Cancer remains.
Yes. So recently we are working with Tata Memorial, Guwahati. So they have asked us to prepare an AI for cancer.
So on, this is only beginning. Brain, lungs, then liver. You can do with other solid organs also.
Exactly. So just the data is needed and the rest is the history. That can be done. Yeah. Thank you.
I invite the next group. We have a team from Dr. Null. It's Dr. Null.
Good morning, everyone. My name is Rahul. I'm the founder for Dr. Null. We are currently screening for pulmonary tuberculosis. We started our journey back in 2016, and Timber is our flagship product that screens for pulmonary tuberculosis, and over a period of time we have accumulated enough data so that it can get screened for COPD and most recently COVID-induced pneumonia. So this is our product portfolio, and there are a lot of players who are doing this voice and cough-based screening using mobile phones. However, we strongly believe that the fidelity is lost when you use the mobile phones. There are different variants. The glass introduces additional frequencies that are not realistic. So we use a third-party microphone array. It's an XY arrangement, and you can capture low frequencies. You can filter low frequencies and so on. And also it works without having to depend upon batteries and electricity and so on. So it is a true point of care device that can be taken to the remotest part of India as a part of outreach programs. And obviously we know interpretation of chest x-rays and interpretation of cough analytics needs expertise. So we typically an ASHA worker can look at the report and determine if a propensity of TB is high or not. So we also offer probability scores for the pulmonologist or the general physician. So that's in a nutshell what our product does, sir.
So this is only limited to pulmonary tuberculosis?
With a single cough as of today, because we have completed third-party clinical trials for pulmonary tuberculosis, COVID-19, COPD.
Why I'm asking this problem with pulmonary tuberculosis diagnosis is not so much as it is for extra pulmonary for us in India. Lymph nodal tuberculosis, tuberculosis elsewhere, abscesses presenting in various other extra pulmonary. So does it give any indication of the diagnosis? So how exactly in pulmonary tuberculosis you are diagnosing or having index of suspicion with this device?
So yes, the focus is we are positioning it as a screening solution for mass population, number one. And number two is it is focusing only on pulmonary tuberculosis, the lungs, anything related to upper respiratory tract infections or lower respiratory tract infections.
That's okay. So what it gives you, the probability?
The probability score and a Boolean value, whether it is having pulmonary tuberculosis or not, whether it is in an active stage.
Correlated it with the like gene expert?
Absolutely. Our clinical trials used reference standards which are gene expert CBNAT and also TrueNAT in some cases. So we went through the whole 9 yards of third-party clinical trials.
So just for our understanding, if a person coughs into your microphone device, from the cough it recognizes whether the probability of tuberculosis or not.
Yes, it's a controlled cough under strict hygiene protocol, and they have to take a deep breath and cough. That is on one side of the coin. The other side of the coin, we take some basic demographic information such as height and weight, and we arrive at the BMI and correlate it with the disease state, sir.
Understood. Thank you. Thank you.
Sure. Thank you very much, gentlemen. Thanks.
So next we have a team from Chikitsa.
हेलो ऑल, गुड मॉर्निंग। मेरा नाम चिराग गोयल है और मैं चिकित्सा का को-फाउंडर हूँ। सो चिकित्सा इज़ बेसिकली अ हेल्थ केयर मैनेजमेंट सॉफ्टवेयर, जैसे कि मोस्टली हॉस्पिटल्स में है, एम्स में भी है, सारे हॉस्पिटल्स में होगा। बट जो एडवांटेज चिकित्सा के अंदर है, दैट इज़ द मेन कि हम जो मेडिकल रिकॉर्ड्स हैं उनको डिजिटाइजेशन के साथ क्रॉस हॉस्पिटल इंटरऑपरेटेबिलिटी एंड जितना भी आपका डेटा है इंश्योरेंस के साथ सीमलेसली आपको क्लेम सेटलमेंट्स हो सके, इस पे वर्क कर रहे हैं। जैसे मैं आपको, हमारा ब्लॉकचेन बेस्ड हेल्थ लॉकर है, जिसमें कि आपका यदि इन हाउस डेटा सेंटर है उसको भी आप क्लाउड पे यदि शिफ्ट नहीं करना चाहते हैं, स्टिल डेटा सिक्योरिटी के साथ आप क्रॉस हॉस्पिटल इंटरऑपरेटेबिलिटी पे हम आपको इजीली इनेबल करते हैं। आपको हमारा HIS लेने की नीड नहीं है, यू कैन जस्ट प्लग एंड प्ले अवर SDK। तो कोई भी मार्केट में ऐसा स्टेक होल्डर है जिसका पूरा सेंट्रलाइज सिस्टम है, एंड दे वांट टू वर्क ऑन द क्रॉस हॉस्पिटल डिजिटाइजेशन एंड विद द डेटा सिक्योरिटी, सो दे कैन यूज अवर SDK एंड वी आर एनेबलिंग देम टू डू द क्रॉस हॉस्पिटल डिजिटाइजेशन। इसमें हमारा जो AI का मेन रोल है, दैट आर एट 2 स्टेजेस। वन इज एट द प्रिस्क्रिप्शन साइड, जैसा कि अभी और भी स्टार्टअप्स ने बताया कि हम भी हैंड रिटन प्रिस्क्रिप्शंस पे वी आर वर्किंग, कि हैंड रिटन प्रिस्क्रिप्शंस को हम कन्वर्ट कर रहे हैं, जिसमें वी आर इंडिपेंडेंट ऑफ पेन एंड पेपर, दैट इज आवर USP। और आपको स्कैन भी नहीं करना है, स्टिल वी आर डिजिटाइजिंग, दैट इज आवर मेन USP। सेकंड इज आवर ब्लॉकचेन, वी आर आई थिंक यस। ओके सो वी आर ओवर ब्लॉकचेन, तो उससे आप बहुत इजीली डेटा को सिक्योरिटी के साथ आप ट्रांसफर कर सकते हो. मेन ऑनरशिप ऑफ डेटा इज एट द पेशेंट साइड. पेशेंट इज द मेन ऑनर ऑफ द डेटा. वेन एवर ही वॉन्ट्स he can give the access of his data to any doctors with the time boundation कि मैं इतने टाइम के लिए देना चाहता हूँ. डॉक्टर्स को एडवांटेज ये है कि पूरा मेडिकल डेटा पे AI के थ्रू पूरी समरी मेडिकल हिस्ट्री पे उनको मिल जाती है, इंसाइट्स मिल जाते हैं, जिससे मेडिकल एरर के चांसेस रिड्यूस हो सके. द मेन विजन इज टू रिड्यूस मेडिकल एरर और डेटा इंटरऑपरेटेबिलिटी. थैंक यू. और हम मल्टीपल लैंग्वेजेस में वी आर वर्किंग ऑलरेडी.
One big problem would be, even if you digitize the data, unless you keep it in real time, and unless the physicians are able to follow up on it. Even if you digitize it, how do you plan to make it real time availability, and how do you improve the compliance of physicians wanting to use a digital system?
So sir, as my background have been from compliances and the things with the 12 years experience, so all the compliances are already in place, not only for the Indian ecosystem but for the global. सेकेंड पॉइंट इज कि यदि मैं बात करता हूं कि हमको डेटा को रियल टाइम पे, तो हमने ऑलरेडी डेटा को अप्रॉक्स 3 to 4 सेकेंड्स के डिवीजन में ऑलरेडी हमने अवेल करा दिया है. वी आर ट्राइंग टू डू मोर बेटर कि सेम टाइम पे हम उसको कर सके. बट जब हैंड रिटन प्रिस्क्रिप्शन की बात करते हैं, सो द बफर टाइम इट टेक्स अराउंड 3 to 4 seconds टू गेट इट डिजिटाइज. So SDK, it depends on the tech stack of the existing HIS in the hospital. जैसे हमने अभी 14 हॉस्पिटल्स में ट्रायल किया है, तो वहाँ पर क्या होता है कि अराउंड 1 से 2 दिन के अंदर दे आर एबल टू इंटीग्रेट विद अस. मतलब हमारा पूरा डॉक्यूमेंटेशन के साथ हमारा सपोर्ट भी रहता है. इट्स वेरी इजी टू प्लग एंड प्ले विद योर एग्जिस्टिंग डेटा सेंटर. नो. थैंक यू.
So, as you can see, most of the technologies here have just started, probably at a very nascent stage. So, one of our primary objectives to conduct this event was to assess opportunities for technological development, and with all the inputs and expertise that was shared here from all of you experts present, I believe the team and all of us will be able to formulate actionable strategies for technological upgradation in the healthcare sector. Saraswati Mahabhage Vidya Kamal Lochane Vidya Rupe Vishalakshi Vidyam Dehi Namostute. Light is a symbol of brightness and prosperity. As light expels the darkness of might, similarly, blessings bring in our life prosperity and happiness. To make this event a blessed one, let us invoke Goddess Saraswati by kindling the lamp of knowledge and wisdom. For seeking the choicest blessings for the same, I invite Dr. M.C. Mishra, Dr. M. Srinivas, Dr. Raghavendran, Dr. Deepak Agarwal, Professor Bhupesh Lad on stage to light the lamp.
Jnana
I would now request Dr. Deepak Agarwal to present a bouquet to our chief guest, Dr. M. Srinivas. I request Professor Bhupesh Lad to present a bouquet and welcome Dr. M.C. Mishra. I would request our Chief Executive Officer, Mr. Aditya Vyas, to welcome Dr. Raghavendran. I would like to extend my heartfelt gratitude to our chief guest, Dr. M.C. Mishra, as well as our guest of honor, Dr. Srinivas, as well as Dr. Raghavendran here, for sparing their precious time and gracing the occasion. We welcome you all, sir. Now I would like to request our project director, Professor Bhupesh Lad, to come on stage and provide a brief introduction about the Drishti CPS at TIIT's healthcare initiatives and also outline the agenda for today's event. Professor Bhupesh, he is a professor in the discipline of mechanical engineering at Indian Institute of Technology, Indore. He has been leading the IITI Drishti CPS Foundation as project director since August 2021. His primary research interests include smart manufacturing, reliability engineering, and prognostics. He is also leading research activities of Industry Academia Consortium on smart manufacturing. Sir, the stage is all yours.
Thank you. Thank you very much, Professor M.C. Mishra, Professor Srinivasan, Professor Raghavan, Professor Deepak Agarwal, ladies and gentlemen, I welcome you all here on behalf of IITI Drishti CPS Foundation for this gathering. This is organized by IITI Drishti CPS Foundation in association with AIIMS, New Delhi. IITI Drishti CPS Foundation is one of the units of National Mission on Interdisciplinary Cyber Physical System, announced by our Honorable Prime Minister Sri Narendra Modi in the year 2019, I guess. Since then, the mission is continuously working on developing technologies and, more importantly, commercializing the technologies. Our focus is on translational research in the area of cyber physical system. To put it in a simple way, we start with the digitization to digitalization, then go to the cyber physical system. This application area includes manufacturing, healthcare, agriculture, smart cities, and so on. One of the important applications obviously is the healthcare. At Drishti CPS in healthcare, we thought of, we had extensive interactions with healthcare professionals from Pratmik Swasthya Kendra to the doctors in AIIMS and other healthcare institutes. And we found that there is a need, so because India is a vast country and whatever you do, you cannot probably reach to the last mile, or our healthcare facility will never be probably sufficient. The solution probably is the digitalization, through which we can probably bridge this gap. So our focus is on widening our reach of quality health services in the country. Second, we wanted to focus on personalized medicine, and the third, the last one is from medicine to actually preventive healthcare. So many places we don't call it patient centric, we call it human centric. We wanted it to be human centric, and we wanted to focus on preventive healthcare. The solution that we are thinking here is the digital twin. which is nothing but the digital replica of the human body, which can be used for better healthcare services. But not to confuse many present here with the digital twin word, just it starts with the digitalization, and then as we move on, we add some intelligent capability, and we have sufficient data. We can probably create a digital replica of the human, and that can be used for better healthcare outcomes. On the technology side, we found that many, as you have seen in the morning, many solutions are getting developed. But then we realize that many of them are not going to the ground. Many are not getting implemented. Many models are getting developed at IITs, but how many of them comes out of the publication? Very less. The reason is probably we need an aggregator platform where all this can be hosted together, and the platform can be accessed by the doctors. They don't need to go to the 10 such solutions or 100 such solutions. So we developed this platform called the Charak Digital Twin, where we, on the front end, we have these technologies. It looks like an aggregator of this technology, but in the back end, the way we collect the data, the way we store the data, the way we model the data, simulate the data, and go for decision making using those data, gives this birth to what we call the digital twin for the healthcare. So this is our focus, and with that we have already integrated many solutions. I think more than 20 solutions are now integrated on our Charak DT platform. The solutions are from various startups as well as the faculty members working across the country. On the implementation side, we are focusing both the extreme. On one hand, we are working with institute like aims. We recently started a project supported by Royal Academy of Engineering and Drishti, which focuses on developing digital twin for critical care units, including the patient and the ventilator system. On the other side, we are talking about digital twin for Prathmik Swasthya Kendra. Can you imagine, still in India, even abroad, the digital twin word is, in healthcare is not that popular. And now we are talking in India for digital development of digital twin for Prathmik Swasthya Kendra. Our support